get everyone in. All right. Thank you all so much for attending. I'll go ahead and pass things over to you, Jeanette, to lead our session today on the healing power of massage therapy. Thank you.
Thank you so much. Hello, everyone. My name is Jeanette Guzman, and I'm a massage therapist at the IMA. So I am going to present this this presentation today about massage, a little bit about massage therapy, and also about our clinic and how we work over there. So let's get started. So again, my name is Jeanette, and I'm just going to start. And first, I just wanted to let you know what massage therapy is. It's really all about, it's more about healing with touch, basically, So and massage therapy is a method that we use to, with manipulation techniques and, kneading and long strokes to uh, uh, I okay. Sorry, I
Sorry
don't know
about
what happened.
that. Just some background mic noise coming in, but yeah, got that
Oh,
sorted.
okay. I'm like, oh my God, what do I do? Okay. So as I was saying, so it's a healing that involves touch to relieve pain, definitely to heal injuries, and by healing injuries, that means recent injuries or also chronic injuries that you had in the past. Um, uh, there are a lot of people sometimes, they get injured and they don't want to see a massage therapist because they think that we're actually going to do more harm. But that is so not true at all, because if you have a recent injury, there's so much we can do. We don't have to necessarily work directly on the injury, but we can do other parts of the body. Um, like if, for example, you injured your foot, obviously you're going to change your gait. And if your gait is changed by the way you walk, and that can also create an imbalance in your spine, in your lumbar spine especially, and then you can have some low back pain. And so if you can come, maybe we cannot do anything about the injury at the moment, but we can massage the other parts of the body. We can massage the other foot. We can massage the low back. We can do so much. So I want to make that clear because we definitely a lot we can do. And of course, like you all know, uh, massage therapy reduces stress. It definitely promotes deep relaxation. Um, if you never had a massage therapy before, you never had a massage before, and you have one, it's almost like it's almost like you become like you're floating, and that is intentional because there are ways that there are certain things that we can do to really reach that state of deep relaxation. The way that we present our massage, the music, of course, their whole environment and everything, the way that we touch and connect with your body is just simply to really make you feel well. And when you come to a massage therapy session, the goal is to simply be able to affect all the possible senses that we can, so we try to do the visual sense, with having a very nice relaxing environment, like you can see in the picture right here. There's candles and it's very dim lit, so that's one way that we can do that. And then we also target the ears by listening to music, beautiful relaxing music. uh, and of course, I myself, when I massage people, I like to also use aromatherapy. And I like to use lavender and peppermint. Lavender is a very relaxing scent. Combined with peppermint, is very good for neuromuscular tension. So I like to combine these two so that not only do I get to relax you, but also affect your muscles by having these two wonderful aromatherapy scent. and they smell delicious. And of course, we use touch, and that's when we do with massage, and then we relax you, doing this very relaxing stuff. And we also target different areas of the body that are more receptive to relaxation. For example, massaging the feet, massaging the hands, massaging the head, the face. These are areas that are highly vascular. And what I mean by that is that they, in addition to having a lot of blood vessels, they also have a lot of nerves. And so if we can inhibit that stimulation, that overstimulation of the nerves, and in, promote more relaxation, you can better relieve you why you feel like you're floating. And so it's definitely an amazing experience, which is why I'm so excited to talk about it today. And then also, as you can see, anybody can benefit from massage. We have babies, to really old people, like anywhere from 90 to 100. The oldest person I have ever massaged was 95. And the youngest has been, literally a newborn. And I just had to tell you this, the younger the human being, the more they like to be touched. So babies are very receptive to massage, and they love that loving and therapeutic touch. And definitely they get very calm very quickly. You can have a baby that is fussy, and you can start massaging them, and they start relaxing almost immediately. Um, and of course, geriatric patients can always benefit with that. As people get older, their joints become more, they become really stiff. And then also the muscular tissue becomes really tense. And so when you give them a massage, it really helps, relieve all that tension in the muscle tissue. And by relieving that tension, you help with the joints so that they can be a little bit more flexible. And so, yeah, it's a good thing. Terminal illness patients, we massage people with cancer, ALS, MS, Parkinson's disease. I have a personal experience. I have a sister who has ALS, and unfortunately, she's in a hospice clinic. When my sister first got diagnosed with ALS, I knew, well, I know what ALS does, and it really starts, deteriorating muscle tissue, and the muscles become atrophied. And that's what happened with my sister. So as soon as she got diagnosed, understanding what happens, I started massaging my sister. And I'm also an acupuncturist too. So I also did a combination of massage therapy and acupuncture. Um, so it really helped. My sister never really had any pain, but she had a lot of tension because these muscles were not getting the blood circulation that they are supposed to be getting. And by getting massages almost every week and combined with acupuncture, she was able to have this assisted circulation, if you will, because we're rushing that blood. When muscles become atrophied, they don't have the ability to circulate the blood like a healthy person would, and so the blood sort of pools, and that's what causes pain, and it also causes stiffness and tension. So I did that for my sister, and it really helped uh, delay some of the atrophy that is associated with ALS, and she did really well for that first year. And I also have people with MS. They get a lot of pain all over their body and the muscle tissue. And that really helps with that. And then with people with Parkinson's, it's a constant contraction of muscle, especially in the hands. They're constantly contracting, constantly moving. And this is nonstop. It does not stop even when you're sleeping. The one time people with Parkinson's experience, relaxation on their hands that they don't move is when they're getting a massage. Because when we massage the hands, they finally get a break. People that have Parkinson are continuously always shaking, but if you give them something to hold on to, the shaking stops. So when we massage, when I massage people with Parkinson's, I'm holding their hands at all time and massaging their hand continuously. So the hands get a chance to rest for a little bit. Um, and it's really an experience, a lot of the time they're really appreciative that for 1 hour, their hands did not shake. So it's a huge deal for people with this neurological condition. And of course, we do other terminal illnesses as well. So it's not that anybody can benefit. So, you know, there's always something that we can do. If we may not be able to cure these diseases, but we could certainly ameliorate some of the symptoms that these people are experiencing. Of course, we also do massage pregnant women. It's really good for pregnant women to get massage because you have a growing human being inside you, and everything starts to change. All these joints become extremely loose and flexible to prepare for the birth. But that also brings other issues. Some people get more attention, and of course, most pregnant women usually have low back pain uh, for obvious reasons. And then, of course, their feet start to hurt. So we massage pregnant women a lot, and they really feel very good. The feeders also seem to like it. A lot of the time, they move around when you're massaging the baby, the pregnant mom. So and also really by releasing all that tension, it really helps them. Excuse me. It really helps in a way to prepare women for birth because you know you your body is going to go through a very traumatic event, and so if you have a lot of tension and then you're going into the birthing session with all that tension, it's very easy to pull a muscle. But if a woman gets massage, at least when I massage pregnant women, I recommend that they come at least once a month. And then as they get closer, the last month before the baby is born, I have them come one time every week so that we can make sure that they keep them not only relaxed but also tension. The tension is not so much, and a lot of the time it really improves the delivery section that they have. They all usually feel really 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 good after that. Of course, we massage everybody, all sex genders and stuff like that. But a lot of people always ask me, what do you normally have? Do you have more men and more women? I will say that, I have a little bit more women than I do men. Um, but we also get men a lot too, So, they're human beings as well, so they all present with tension. So we do that. But women is a little bit more predominant than guys are. But a lot of the time, the wife bring their husband, and then once the wife brings the husband, then the husband wants to have a massage all the time. So it's a competition between the wife and the husband. But yeah, we'll do that. And also animals, they can also get massages. The most animals that get massages are horses and dogs. Those are the two most common animal massages, but of course, any other animal can massage as well. So I'm just gonna move on next to my next slide. And I just wanted to briefly talk about massage therapy. So massage therapy has been going on for 5,000 years. Um, it was first discovered, in Egypt and in India and China 3,000 years ago. That what they used to do. The Egyptian slaves used to massage the pharaoh, and and that's how it was. And they also use aromatic oil for that. Then the Japanese monks brought it to Japan. When they did that, it was more in the form of shiatsu, which is acupressure therapy. And so it's very similar to shiatsu. Follow the similar principle of uh, acupuncture in that you put the acupressure in very similar acupuncture point and press on those areas. It's a very effective technique for people who are afraid of needles but still want the benefits of acupuncture. So that's also one way to do that. And then, of course, the Greeks and the Romans, they use massage a lot, uh, for everything. And then in the 1800s, we have what we call the father of Swedish massage, and that was Dr. Ling. And see if you can see this person right here. That's him. He discovered. Well, first of all, he discovered what they call Swedish gymnastics. So he believed that by moving the body and stretching the joints, that brings healing to the muscle tissue because you are circulating blood. And so that's how he believed in and then when he finally decided to add more stock, in which I'm going to talk more about it later, but he first started with the Swedish gymnastics, and then after that he added some stocks to go with the Swedish gymnastics that he felt that were better for relieving pain and also increasing the endorphins and all of the associated hormones that help promote relaxation. And then, as you all know, massage parlors, the infamous massage parlors that we had in the early 20th century, what that really is, towards the late 19th century and early 20th century, there were a lot of schools that were promoting massage therapy, and they kept on saying, well, if you come to our school, you can have a very good profession, and you can go and you can have all these clients, and you're going to be rich and all of that stuff. So a lot of women went to school to become massage therapists, but sure enough, when they graduated, they didn't have any jobs, and then they had this amount of money that they owe. So it was sort of like a scam to get people to sign up for the school, but they never really got the clientele that they were hoping. So they had this huge debts that they needed to pay, and so that's why it was associated with sex trade. So okay, since they couldn't pay with money, okay, well then you're gonna have to pay someplace else. You have to pay. You have to find a different way to pay. So that's why, unfortunately, massage therapy back in the days was associated with sex trade, and that was the reason why. And current practice today, we need to, at least in the United States, you have to be licensed. It is illegal to practice massage therapy without a license. So you cannot practice massage if you don't have a license, and if you don't have a license, it better be under the umbrella of a school, or you cannot charge any money. But you really do need to have a license. At least in this country, you do. So moving on to the next slide. So this is what I was telling you about what Dr. Lim created. This is the Swedish gymnastics, and so basically, it was very similar what we will be today, Thai yoga, Thai massage, which is all stretching. And so that was basically to promote uh, more circulation to the joint and the muscle tissue. So that's how it started. And then later on, he added manipulations to the body to promote the healing for all these tissues. So here's the clinical benefits of massage. Well, as I mentioned earlier, definitely improve circulation. Uh, that's the one thing that we do. We always want to make sure that when we massage, that we always rushing blood towards the heart. And it certainly improves that when muscles are really tight. As I mentioned earlier, blood tends to pool. And when blood is pooling, that's what causing that tension and that pain. So when we put the pressure on this tense muscle tissue, you really can increase that circulation so that gas exchange can happen because when it comes to tension and pain, it's all about the gas exchange. And by gas exchange, I mean you want to deliver fresh oxygenated blood to that muscle tissue, and in turn, they take the waste, and we take the muscle tissues take the nutrient and the oxygen, so pain can decrease, and the tension also can decrease, and of course, as I said, it decreases pain because you're also bringing fresh oxygenated blood to muscle tissue. You have the ability to boost immunity. You decrease stress. And of course, by decreasing stress, you improve anxiety and depression because you have the ability to release endorphin that makes you feel good. And of course, when you've been relaxed, blood pressure decreases because we are inhibiting that. Um, for one, we're decreasing the blood flow so that yes, we're improving circulation, but at the same time we're also decreasing it so that it's more efficient. So you have this, so the blood vessels are more open and blood can rush, and going to that muscle tissue. It facilitates the release of endorphin and enkephalin. So endorphins, as I told you, is endorphin and enkephalin are neurotransmitters that have the ability to decrease pain, especially enkephalin. So by rushing this blood and pressing on the muscle tissue, the skin has pain and pressure receptors that trigger the brain to release this hormone and the neurotransmitters so that you can have less pain when that happens. And then of course, we promote peacefulness and serenity. People usually feel much better and more serene, even if you had a bad day. I had clients that were extremely angry, and I tell you, I can turn a kitten into a lion. These people really, they were really angry, and then by the time they're finished, an hour later, they feel completely happy and relaxed and more able to face whatever was bothering them with a more positive attitude, if you will. And of course, because we are removing the tension from the muscle, that has the ability to improve flexibility. And again, like I said earlier, we decrease muscular tension. Can also reduce scar tissue formation. So when people have gotten injuries or when they have a surgery, scar tissue forms. So we have the ability to break that scar tissue. So I always tell my clients, if you know you're going to have a surgery, make sure that you come see me almost as soon as you starting to feel better, so that we can start breaking that scar tissue, so that the scar tissue doesn't form in the muscle. So because when you have a surgery, whether it's by an injury or when you have an injury, whether it is done because you had an injury or you had a surgery, it always alters the muscle fibers, and the scar tissue forms against the muscle fibers. So that's not really a good thing because then you really alter the integrity of that muscle tissue. And by altering the integrity, you reduce range of motion. And that is especially true if the injury was in the shoulders and then you had a surgery on the shoulder, that you can experience a decreased range of motion. So if you come right away, we can start breaking that scar tissue. So of course you're still gonna form, but not as much, and it really will save that range of motion on the joint. And of course, when people are stressed, they usually almost always have digestive issues. If we decrease the stress, a lot of the time the digestive issue associated with stress also will decrease as well. So here's the techniques that I was telling you that are part of the traditional Swedish massage. So in addition to Swedish gymnastics, Dr. Ling also created effleurage. And what effleurage is, as you can see in the picture right here, it's really nice light stroke along the muscle, and the ability to, it has the ability to really release these endorphins and reduce pain. Petrissage is what we call the kneading, as you can see that here, and we use that on the belly of the muscle, and really knead that belly. And that is sort of to break scar tissue that is forming along the muscle fibers. And then also they feel good as well. Cross fiber friction. So it's simply, again, that's what we use to break the scar tissue, and then we go against the muscle, excuse me, we go along with the muscle fiber, but against the scar tissue, so you can break that. Friction and that direct firm pressure, and as you can see right here in this picture. So we, put the hand where we slide the hand all to the back or the leg. So it's nice, direct, firm pressure that definitely feels amazing, when you're getting a massage, especially if you have tight shoulders or tight hamstrings. So that what we do that. And then taputment is, what you see right here, like what the karate chops. That is mainly used, I like to use it sometimes if I want somebody that wants to feel vigorous, like if somebody's gonna do uh, a marathon or something. That's something that I would do really quick. It's just to bring more, to excite the muscles more, to bring more vigor. Uh, so I don't do that all the time because most of the time people come, they just want to feel relaxed. So, and of course, you already know Swedish gymnastics. And these are the main types of massage that are very common. So Swedish massage is what most people know as relaxation massage. Deep tissue massage, that's strong pressure along the muscle tissue. Most people usually like this because they like the feeling. It hurts a little bit, but it also feels good at the same time. So they really like that. And then sport massage, that's what I was mentioning earlier with the taputment. You do stretching and then you do the striking motion to bring more vigor to the muscle tissue. Pregnancy massage, I already spoke about that, and usually done with livestock. We can do deep tissue on pregnant women because, for one, they have more flexible joints, and so we don't want to reduce the tension of the muscle already when the joints are already too flexible, right? Another issue too, it has especially in the first trimester, if you put that strong pressure, it has the ability to create contraction. It can also, you don't really want to do that on that first trimester because we don't know how the person's going to be. So for that reason, we prefer to just do the light touch. But I sometimes put a little pressure on the feet, that's away from the fetus, or maybe a little bit on the shoulders or the neck, but from the neck down, no pressure at all. even if they're begging for it. No, you don't do that. So they just have to wait until the day before. And then the chair massage is usually a cloth massage. It can be in a chair or it can be on a table, as you can see that here. Um, this is nice, that's usually what happens when people go to the office. And we don't have the ability to remove the clothes, but they still want to be relaxed. So then you do the massage to the clothes. Also, we can also do clothes massage with combine it with sports massage, in like a sporting event. Clearly, we don't have a place to remove the clothes, so we do it through the clothes. It's really effective. It's nice. I prefer to work directly on the skin, but this will also work too. Other massage modalities, like I mentioned earlier, aromatherapy, that's just done obviously with aromatherapy, but people have the ability to choose the scent that they want, and so that also feels good. And that usually happens more in spa massages. Shiatsu, I already explained. Reflexology is pressure points on the feet. So the feet has pressure points on the bottom of the foot that also work. So there are over 100 pressure points on the feet that affect the entire body. And so you put that pressure on a certain point on the foot to affect a particular part of the body. And it's really effective, very effective. And the entire section will be on the foot. So you only need to remove your shoes and your socks because it's all about the feet. So you do both, obviously you do both feet, and you affect that. I also do reflexology and I find that very effective as well. And I really like that. Stone massage is that they get smooth reverse stone massage. And then you put them in really hot water, and then take them out and then let them cool a little bit, but not too much. And then you massage with that. It's really nice because the heat goes. It's almost like it melts the fascia, and so and the strong texture of the stone really helps decrease tension. So you had the heat and the strong texture of the stone, but the river stones are usually very smooth. So it feels really nice with the oil, especially if it's aromatherapy oil. Uh, it feels really nice. You might want to make sure that if you're going to have it in the winter, don't have it on a really hot day because you're going to be hot after the session. You're going to be hot for at least 2 or 3 hours, and if you get it on a 90-degree weather, that's going to be pretty hot for you. So if you want to experience that, I will have it in the winter. It can also be done with cold stone, and that also feels just as well. That feels really good as well. Reiki is energy work. And then Thai massage, like I said, is what they call yoga for lazy people. So basically, you're just stretching the person, as you can see that here. This is a form of a Thai massage stroke. I done this and it feels very nice because you're really stretching all the chest right here, all of the area that doesn't get stretched. And what do people do nowadays? You spend a lot of time in a computer, you're all constantly slouching. When you do this stuff right here, you're opening up that chest, and it really feels really nice. So they're stretched. The entire session is all about stretching. Some people will put you on a table. A lot of the times they do it on the floor, on top of a mat, and it feels fantastic. Lomi Lomi massage is Hawaiian style massage, and that's usually what I do. And so what you do, you use your forearm and massage the entire body. Lomi Lomi is meant to mimic the waves, so it has a wave-like style, if you will. It feels really good. You just have to come and try it yourself. Intraoral massage is that massage inside of the mouth, and what we do. I also do this type of work. This is usually for people who have TMJ issues, or they have an injury in the face or in the mouth. A lot of the time, the joint will be compromised and people will have pain. It hurts. They can eat really well. They grind their teeth at night when they're sleeping. Uh, Sometimes when it gets so severe that people they have headaches and stuff like that. So by releasing the tension of the muscles that the muscles that open the mouth unfortunately attach inside of the mouth. So you have to go inside to release the tendons so that they are not pressing so hard on that joint. You release that, and a lot of the times people feel a lot of relief with that. Um, and so I do that. And when I do intraoral, I prefer to do it with acupuncture because it really enhances the treatment better. And then breast tissue massage, this is exactly what it is. Drape or undrape, direct massage on the breast tissue. So I'm also certified on that. I do that a lot. It's very effective for people who have mastectomy and breast reduction. Also pregnant women, lactating women. So you massage the breast directly. For both intraoral and breast tissue massage, not only you have to be licensed, you must be certified by the state to be able to do that. So that you have to have that certification so that you know that you're getting a very professional treatment. Okay, so moving on. So we talk about a little bit of self-massage. I mean, there's a lot of stuff that you can do, but I decided to simply put the feet. For one, the feet don't get as much attention as they should, and they work very hard. For some reason, people don't feel too happy with their feet, and they neglect them a lot, but they do so much for us. So I chose the feet because it's really easy to do, and it really also takes care of a lot of issues. By massaging the feet, you can sometimes alleviate knee pain and even back pain. But this is usually best for plantar fasciitis. And what happens is at the bottom of the foot, there is there's also fascia, but there's also a connective tissue that connects the metatarsals to. So the metatarsals are this bone right here. If you can see that. Oops, excuse me about that. And so it connects this bone. The connective tissue connects the bone to the heel. And so when that hardens, that's what creates the plantar fasciitis. And so when people are sleeping and they wake up in the middle of they wake up in the morning, and then as soon as they put their feet on the floor, it hurts. And the reason for that is because when you're sleeping, your body temperature decreases. And so the connective tissue is not warm as it is because it's not really muscle, and it's just connective tissue made out of collagen, and collagen is not very vascular. So when you wake up in the morning, there's not your blood pressure, your temperature decrease, and then you get up, and then people feel that pain in the morning. If anybody that has plantar fasciitis, they have this issue. If you do this at nighttime, and you also stretch the foot, significantly decreases the chances of you having that plantar fasciitis. So I decided to put this one because it's easy to do. You can't go wrong with that, and it's very helpful. And then also, this is a frozen bottle. When the feet are really tired, you really want to put that. When they hurt, it really decreases some of that pain. So you want to do this. So I'm going to sort of contradict myself here, but so you want to do this if your feet hurt, you want to do this at nighttime to relieve some of the pain. But As soon as you're done, as soon as the pain has gone away a little bit, and what you want to do, you want to roll it on the bottle. That then you go back and do this. So you want to bring here, the point is to, to take away some of the blood that's causing that inflammation. But then after that, you want to bring fresh blood, and you want to do these exercises so that you bring in fresh blood and you also improve in the circulation. If you don't do this after you do this, remember uh, you already have a connected tissue that is pretty tight. And if you only do this, and when you go to sleep, your body temperature decreases, then you really are going to wake up with that severe pain. So make sure that you do this and then do this, if that makes sense. All right, so moving on, so just gonna talk a little bit about at the UW Recreation Massage Clinic. So as you can see, we are located in the Fitness and Wellness Office of the IMA. So we normally provide 25-minute relaxation massage. It's really hard to do the whole body in the 25 minutes because it's gonna be a very fast massage. So a lot of the time we usually just massage the back. When people come in, they're more than welcome to remove anything from the hip and up, so they can remove, they can remove the t-shirt, they can remove the bras or whatever, but the pants must remain on. If you have any issues on the legs and you want massage in there, that's totally okay, but you need to wear shorts, and then we can massage the legs, but you cannot be up, clearly you cannot be unclothed, and you cannot be on your underwear. So a lot of the times a lot of people usually, especially the students, they usually have a lot of tension on the back and the shoulders. So we just do a 25-minute upper back massage, and that usually helps a lot of people. But I have had a few people that have issues with the legs. Then I tell them, well, make sure that you bring shorts the next time, and then we'll massage the legs. It's a really affordable price, $20 for students and $35 for employees, plus their spouses or whoever they want to put. You can only book up to 6 sessions per quarter. So after you reach the 6th section, then you have to wait for the next quarter. And also you need to book way in advance because we book extremely fast. We were already booked the second week of this quarter and also the second week of winter quarter. We were booked. So as you already know, we're already booked. So if you want to come and see us, then you're going to have to wait until summer quarter. I already said that the clothes have to remain. Unfortunately, due to the state mandate, we still have to wear a mask during the massage session. And also, you need to be on time. If you are 5 minutes late or more, unfortunately, we can do the massage. We don't have time. 25 minutes is already short as it is. And by the time you tell me what the problem is that you want me to focus on, and by the time you remove the top, it's almost time for the massage to be done. So if you're there 5 minutes late or more, unfortunately, we won't be able to do the massage. Cancel, just finish, cancel the massage 24 hours in advance. And then our hours of operation, we have massage Wednesday through Saturday. So I work Wednesdays and Fridays from 4 to 7. And Thursdays, we have Kim, the other therapist, and she works on Thursdays and Saturdays. And then, so what to expect from us when you come? Well, definitely licensed massage therapy. A lot of people that come over here, because the massages are so inexpensive, they don't think it's valid. And so they always think that we are either amateur or we are students. And like I said earlier, you must have a license to practice in this country.